Hi, my name is Aisha.
And I'm Sarah.
We are orthoptists and we work at Great Ormond Street Hospital for children in London. Our team works with children and young people who have complex and often rare problems with their eyesight. And of course, we also work with their families and carers to help them understand the assessment and care needed. You may have an eye test appointment coming up and may want to know what the test actually involves. We have some frequently asked questions from families about children's eye tests.
What do you need to know before the eye test appointment?
You will be told where you need to go in the hospital for your appointment. This information might be in an appointment letter, in a text message, or sometimes a healthcare app message. It's a good idea to arrive a little early with your appointment details to hand. Hospitals can be big places like Great Ormond Street Hospital, but the reception staff can help you find the right department.
The appointment may last a few hours because of the number of specialists your child may need to see. It's a good idea to bring along snacks, water and things to keep the little ones entertained.
When you arrive at your appointment, you will check in at a reception area and be asked to wait there first. You may then be called by a clinic assistant or nurse for some health checks, which might include height, weight and blood pressure.
What happens during an eye test?
Usually the first part of the eye test is conducted by an orthoptist, like me, an eye specialist. The orthoptist will assess your child's vision and look at how your child's eyes move using a range of different tests. When we are finished, we will discuss our findings with other team members.
Why are eye drops sometimes used during an eye test?
There are different types of eye drops we use in the clinic. Some of these drops are used to make the pupil bigger so that it's easier to look inside of the eye and to check if glasses are needed. The eye drops can make your child's vision blurry for a few hours, and because they make the pupil bigger, your child may find bright light like sunshine uncomfortable. So you may want to bring along sunglasses for sunny days. Sometimes the effect of the drops can last all day.
Why is imaging used for an eye test?
Sometimes your child will need to have a photograph of the back of their eyes. This may be done in a different room or area of the hospital by imaging specialists who are experts at using special cameras and machines. These pictures contain information which contribute to the overall picture of the eye health.
Are there any other tests I need to know about?
Depending on your child's condition, the team may request tests to check their field of vision or some electrical tests that check the functioning of the tiny special cells in the sensory layers of the back of the eye and in the brain.
What happens after all this? In our team, there are different types of healthcare professionals who all work together. We also work with other departments within the hospital.
After your child has had their check with the orthoptist, had their eye drops and imaging if needed, they may see an optometrist and an ophthalmologist. An optometrist is a type of specialist who may check to see if your child needs glasses.
Ophthalmologists are doctors who deal with eye health. They may use all the information gathered about the child's eye test so far to help decide on the best way forward for treatment.
All eye departments are different, and sometimes children may be seen by one or two of these specialists. In some departments, nurses, orthoptists, imaging specialists and optometrists may run clinics on their own without doctors.
What do I need to do when the appointment is all done?
Each child is different, and depending on their eyesight condition, the need for future appointments and treatments will be different. You will be informed of this by the team and follow-up information will be given, usually in the post or online.
Sometimes children are prescribed patching therapy to treat reduced vision in one eye. If your child needs to use patches, you'll be given information about how to use them and where to get further supplies.
If your child needs glasses, you may be given a prescription to take to your local optician. Sometimes if your child has a complex prescription or requires special glasses frames, these may need to be fitted at the hospital. If your child is okay to go to a local optician for future glasses checks, then we will let you know.
Take a look at our other videos if you want to learn more about eye health in children.